flu season might be an added burden on the health system. Now, the big question is, how will the system manage the flu season amid the coronavirus pandemic? And when will it be the right time to get the flu jab? Well, to help us understand this, I'm joined now by the University of Cape Town's Professor Mark Mendelson. Prof, good morning and thank you very much for your time. What prompted me to want to have this discussion today was I was thinking about all kinds of information that's doing the rounds about how long it takes after you've got the COVID-19 jab to build up immunity. I had some people saying it could take up to 4 weeks. I don't know. Now, 4 weeks from now, we are towards the end of March, and that means we are almost at the beginning of autumn, heading towards our winter season. Now, I take a flu jab every year for, I don't know, more than 20 years now, and I normally do it around about March, April. Now, we've got the coronavirus pandemic complicating the situation. Should we be worried about the flu season?
Well, good morning. So influenza, as you say, is seasonal. It generally starts around May, June, and lasts anywhere between 9 and 13 weeks. The vaccine tends to arrive in South Africa, the vaccine that's been procured for influenza, somewhere from now, and usually is available March, April. So I think there's the two different parts of your question. The question about the COVID vaccine, Johnson & Johnson, how quickly does an immune response get seen? And protection start to occur, and the immune response after the COVID Johnson & Johnson vaccine was first seen around 14 days. In terms of influenza vaccine, again, vaccines take time for the immune response to occur, but again, usually it's around 10 to 14 days that one would start to see the immune system kick in. So that would give you ample time in terms of having your vaccine March, April, and the flu season starting probably in May or so. So influenza vaccine, as you say, is incredibly important public health intervention in our country and, in fact, across the world.
Yes, okay, so it's two parts to this. Let's start with the Johnson & Johnson COVID-19 vaccine, just to understand. You said it takes about plus minus 14 days, 2 weeks to begin to build up a bit of protection and immunity for you. So at this rate, from what we understand, we've got the 80,000 doses now being administered. So it looks like we're very much in time ahead in terms of the winter season for building immunity. By when should more and more people be vaccinated in terms of Johnson & Johnson for us to be able to manage during the winter season?
No, again, there's a number of different issues in your question there which are important to address. I mean, obviously the people who are going to be protected from moderate to severe disease, which is what the Johnson & Johnson vaccine has shown us against COVID-19, are those that are vaccinated. Those that remain unvaccinated, unless they have any natural immunity from having had COVID-19, will not be protected. And with the number of vaccines that we're going to be rolling out between now and the traditional winter respiratory viral season, is not going to be enough to, in all likelihood, to prevent a third wave of COVID-19. Now, it's a separate issue around influenza. Last year, actually, just before the initial lockdown, we did start to see the takeoff of influenza cases in the Western Cape. But a multitude of factors, including the lockdown, school closures, the wearing of masks and the public health interventions, and a reduction in travel and import of influenza from the north, all played into really quashing that influenza season. So we didn't, like elsewhere in the world, in fact, we didn't see an influenza season of any note last year. That may be the same this year, but that is by no means a foregone conclusion. And therefore, it's really important that the people who are at risk of severe influenza are vaccinated, and there are defined high-risk groups that need to be vaccinated and should come forward, as always, as in any season, to get vaccination and protection against influenza.
Okay, and that vaccination protection against influenza would be wise to do when? From March, April this year?
As soon as the vaccine becomes available, people who are in the high-risk categories should start to get vaccinated.
Just very briefly, Prof, before I let you go, remind us of those high-risk categories.
So for influenza, the high-risk categories are pregnant women, people with immunosuppression, so the HIV population, people with pre-existing diseases where a second hit from influenza would cause serious problems, and those would be people with chronic lung disease, chronic neurological problems, chronic cardiac disease, and also importantly healthcare workers, because again it's about protecting the integrity of the healthcare system, and particularly in this year with COVID-19 as well, we need to be absolutely sure that we're not getting absenteeism in our healthcare workers from influenza as well as potentially COVID.
Professor Mendelsohn, thank you very much for your insights and your advice there. Very sensible. Do not underestimate the importance this year as well, if you are in any of those risk categories he's outlined, to get your influenza jab as well. That's the flu jab as soon as it becomes available. And normally it's expected that your seasonal flu jabs will be in the country anywhere from March and April. I do that myself every year. So with the COVID-19 vaccine focus, which is important, let's not forget that there's that small matter, very important matter of the influenza vaccine as well. Still ahead on